Good afternoon. I'm so honored to be here at the White House for the very first official World Hepatitis Day briefing. I'm truly hopeful that today's briefing is a significant step forward for fighting against the spread of hepatitis. As chair of the Congressional Asian Pacific American Caucus, I want you to know that the prevention of the spread of hepatitis B is one of our top priorities. Hepatitis B has for far too long been the silent killer of Asian Americans. While we make up 5% of the population in the U.S., we account for more than 50% of the hepatitis B cases. In fact, all of us know somebody who has the disease. I certainly do. A few years ago, I had the honor of supporting a good friend and longtime community activist, Chi Moy, in his run for city council in the city of San Gabriel in my district. Chi won, and the community rejoiced to have such an excellent leader succeed. One day, in his 40s, Chi tried to donate blood and discovered that he had hepatitis B. 2 years later, it turned into liver cancer. We watched as Chi grew more fragile, and as he fought the disease valiantly, hanging on until he was sworn in as the first mayor of Asian descent in the city's history. A month later, he died at the age of 53. Hepatitis B took away one of our community's most passionate champions, just as he was poised to truly make a difference for his fellow residents. And the hand of hepatitis C is not too far behind. 20 years ago, my sister-in-law, Judy Chu, was diagnosed with hepatitis C. It progressed into liver cancer late last year, and last Monday she succumbed to the disease and passed away. The greatest tragedy is that these deaths were entirely preventable. And I share these stories because today, on World Hepatitis Day, it is more important than ever to make sure that those of us who are susceptible to the disease do get tested. And alarmingly, those who undergo regular checkups may not find out that they have the disease until it was too late. And that is because testing for hepatitis C and B are usually not done during regular exams and blood work unless people ask for it. So we must work on all fronts. That is why we must make sure that those who are susceptible are tested and those who are infected become aware of the condition and get treatment. That is why I've co-authored legislation, Congressmember Mike Honda's legislation for a national public health response to this disease. And that's why I applaud the comprehensive plan that Dr. Howard Koh has led, the plan of HHS to make vaccinations and screenings routine in every hospital and clinic across the nation. I want you to know that you have strong allies in Congress. We will not give up until this disease is eradicated, and we will make sure that these silent killers are put to rest. Thank you very much.